So I want to thank each of you who served on the task force with so much commitment and energy. When we started out in our first meeting right here in this hotel on October 14th, only 92 days ago, it was hard to imagine how we could possibly fulfill our mandate in such an abbreviated span of time. Yet today, we've not only finalized our recommendations, but also approved a blueprint that provides a clear guide for ending the AIDS epidemic here in New York State by 2020. Importantly, we carried out this task in full consultation with hundreds of stakeholders around the state and with every decision achieved through consensus. Thank you to all of you for helping to make this happen. The truth is, though, that we could not have accomplished this work by ourselves. Scores of people around the state submitted formal recommendations, many very detailed and clearly took much thought and hours. Many others spent hours in listening sessions and other formal and informal conversations, brainstorming, criticizing, and helping us think through our ideas. Still, even at this late hour, if you look around the room, there are many of the experts from the various state agencies who have answered countless questions and contributed their own suggestions. And then I would be very remiss if I left out our facilitators who tried gently to wrangle us through this process, and the members of the AIDS Institute staff from Albany, New York City, and the field offices around the state who went well and above and beyond the call of duty to ensure that we had full access to each other, to the community, and to every resource we needed, and most importantly, to ensure that we met our deadlines. Dan O'Connell, Joanne Morn, Karen Hagos, Deborah Dewey, Angela Rivera, Tamika Collado Robinson, Sarah Ryan, Kimberly Farrow, Maria Tisai, Heidi Eoch, Regina Blakemore, Jacob Lowry, Sean Horn, Joan Edwards, Maria Perez, Debbie Quinones, Robert Morris, and Louise Square are the people who made this all happen. So please. As well, I think they were called camp followers, but I want to acknowledge staff from Housing Works, TAG, ACREA, the Latino Commission, and other groups who, while not members of the task force, worked as hard as any of us who are sitting at this table to help get us to this point. And lastly, though she's not here, I want to again thank the Governor's Deputy Secretary for Health, Courtney Burke, for being a stalwart champion of this effort. And you should know that we have met with her on a regular basis throughout this process, so she has stayed very much informed each step of the way. And I believe she knows that we are counting on her, along with her new Assistant Secretary for Health, Tracy Gardner, to help ensure that this blueprint is approved and fully implemented. So, in my opening remarks in October, I spoke of an unseen balcony in the room filled with familiar faces looking down to monitor our work. Well, the folk in that balcony have been haunting me ever since, shouting out suggestions, catcalling, hissing, and even booing when they thought I screwed up. The Honorius, and that would include both Keith Kyler and Dennis DeLeon, troubled to remind me of how inconsistent some of our recommendations are today from positions I fervently defended in the past. Kinder observers comforted me by conjuring up memories that hadn't flashed through my mind in years of ACT UP meetings and demonstrations, singing, telling dirty stories, or just sharing vicious gossip to while away time in jail, testifying and then interrupting meetings of the Public Health Council, dealing with an AIDS Institute site visit that didn't go so well. Then there were others like Yolanda Serrano and Rod Sorge, whose names I hadn't mentioned in October, both pioneers in harm reduction, and Willis Green of Upper Room AIDS Ministry, now Harlem United, and of course the incorrigible Spencer Cox, who demanded that I acknowledge their presence in the balcony as well. But to be honest, nothing brought back such a flood of memories, introspection, and reflection as the announcement of the death of former Governor Mario Cuomo on New Year's Day. I cut my teeth as an AIDS activist challenging this man. I participated in more than one sit-in right outside his office back in the day when you could still get access to that corridor. I helped take over the office of his budget director and was a proud member of the ACT UP Housing Committee's Mario Antoinettes. Adorned in 18th century gowns, powdered wigs, or in my case, my own long hair piled high, with Mario ball masks, we strewed Entenmann's cake crumbs throughout the Capitol building, demanding more money to house homeless people living with AIDS. But much as I always wanted Governor Cuomo to do more, objectively as it turns out, he was quite a leader in response to the AIDS crisis of his day. You will remember that in 1983, AIDS in New York was a gay disease. Yet, within 6 months of being sworn in as governor, Mario Cuomo signed into law a bill that created both the New York State AIDS Institute with $5.2 million in funding and the New York State AIDS Advisory Council, making New York State the first in the country to develop a formal centralized program in response to the AIDS epidemic. Each year thereafter, the governor added more resources to the AIDS response and to the AIDS Institute budget. This included bringing into existence the CSPs, community service providers, many of whom have been represented on this task force. Similarly, he could claim credit through the AIDS Institute for the designated AIDS centers, also represented here at the table. In 1988, Governor Cuomo used his State of the State address to call for the development of a master plan to address the AIDS epidemic. That same year, New York State enacted some of the strongest civil rights protections for people with HIV in the world, including the confidentiality law known affectionately as Article 27F. The AIDS plan, announced in 1989, would ultimately lead to the development of the multiple service agencies and the Community Development Initiative, community follow-up case management programs, AIDS adult day programs, and even the syringe exchange programs, all brought to life in his tenure and under his leadership, such that by the end of Mario Cuomo's third term, New York State had created the largest and most robust HIV/AIDS prevention and care infrastructure in the world. The truth is that Mario Cuomo did not do this alone. Senator Roy Goodman, a Republican from the Upper East Side, developed the initial legislation for the AIDS Institute and the AIDS Advisory Council. Assemblymember Dick Gottfried was also an early champion, as he is today, along with many others on both sides of the aisle and in both legislative houses, including in particular members of the Black and Puerto Rican caucus. And Governor Cuomo had to contend with his own health commissioner, David Axelrod, no shrinking violet, as well as some very loud chairs of the AIDS Advisory Council, first Bishop Paul Moore, and then Dr. David Rogers, giving Marjorie Hill some very big shoes to fill. Moreover, the first directors of the AIDS Institute were fierce advocates in their own right. Mel Rosen, followed by Nick Rango, whose internal advocacy was often indistinguishable from that of community activists, and who set a tradition of leadership and advocacy that has been followed by each of their successors, 3 of whom have participated in this process and were in the room today. Even back then, some of the recommendations coming from the AIDS Advisory Council and the AIDS Institute were too radical for Governor Cuomo. including condoms in prison and an override to community siting processes for AIDS facilities. Not only did Governor Cuomo acknowledge the role of AIDS activists, he sometimes actually welcomed it. At a 1989 press conference announcing what he acknowledged was an insufficiently resourced AIDS plan, Mario Cuomo challenged AIDS activists to, quote, goad us, plague us, hold up your signs, and call us names, end quote, all of which we certainly did. But the truth is, at a time when the President of the United States could not even be bothered to utter the word AIDS, and when many others were doing absolutely nothing, Governor Mario Cuomo did more to address the AIDS epidemic than any other executive of that time here in the United States or anywhere else in the world. So it's only fitting that in the year before his death, Mario's son, Andrew, committed New York State to be the first state in the United States to end the AIDS epidemic and appointed this task force. It is also fitting that, like the early AIDS Advisory Council, we've gone beyond simply fleshing out the 3 pillars articulated by Governor Cuomo, as well as the target of less than 750 new infections in 2020. Instead, we've offered recommendations that will get us to 0. 0 new HIV infections, 0 AIDS mortality, 0 stigma and discrimination. Some of these recommendations are as old as the recommendations written in Mario Cuomo's day. Condoms in prison, housing and transportation for people living with HIV. Others, such as full syringe decriminalization, banning the use of condoms as evidence, and giving transgender people full equality, are issues that are not at all new to this administration. But others are new and have been challenging even to some of us. Permitting minors to consent to both treatment and prophylaxis, a PrEP registry, bidirectional use of surveillance data. In offering these ideas and this blueprint, we've honored the charge given by Governor Cuomo, who at his recent inauguration not only reaffirmed our state's commitment to be the first to end the AIDS epidemic, but who also declared, quote, it's time to be bold, my friends, because there is no small solution to big problems, end quote. We have indeed fulfilled the charge to be bold and look forward to the governor boldly embracing the blueprint in full. So our work as a task force has come to a close, but our work to see these recommendations realized and to bring about an end to the AIDS epidemic here in New York has only just begun. The goal will not be achieved unless each one of us who has been a part of this process makes the commitment to do everything in our collective power to see this blueprint fully implemented, including every one of the elements that will get us to 0. I look forward to working closely with Marjorie and the AIDS Advisory Council, and I look forward to working with each one of you here to make this happen. God grant that this mark the beginning of the end of this plague, not only here in our own state, but around the nation and indeed the world. Only then will those in that unseen balcony let us know that we've done our job well. Thank you.